if I told you that the next Prime Minister of Canada is a banker who's never had a concrete healthcare plan, never worked in public service, and could quietly open the door to privatizing medicine? Mark Carney isn't a doctor. He's not a policymaker. He's a global finance executive, trained to save banks, not people. And yet the rich folks are lining up to back him. Canadians beware. The future of your healthcare might just get Americanized. Today in brand new celebrity health news, get ready to be informed. If Mr. Carney gets into power, your access to public healthcare could be the first thing on the chopping block. Let's talk about why it might happen. Last March, Canada rolled out the red carpet for Mark Carney, the 59-year-old former top boss of the Bank of Canada and the Bank of England, replacing Justin Trudeau, who just announced his resignation as Prime Minister in January. Before Mr. Carney became a household name in business and politics, he had his humble origins in Fort Smith, Northwest Territories, Canada. Born on March 16, 1965, Mark was the son of a school principal and a teacher. Behind his sharp suits and serious personality, Mark Carney is a true family man at heart. Carney has been married to Diana Fox Carney for almost 30 years now. Together, they have 4 daughters. Yeah, Hallmark Channel, take notes. Sounds like the perfect family you should feature in your next Christmas film. In his free time, Mark likes home-cooked meals like a nice butternut squash soup. Yum! Also, let's not forget Carney's love for hockey. He's an avid fan of the Edmonton Oilers. Enough said. The economist turned prime minister seems to be the best pick to lead Canada. So how is he keeping his chill in these stressful times? And how good will he be if he becomes the next Prime Minister of Canada? Is Mark Carney the guy to make some actual changes for the healthcare of millions of Canadians? Let's break it down. Carney versus Singh. Who has a better healthcare plan? Mark Carney, the appointed Prime Minister 2 weeks ago after the Canada-US trade war, has called a snap election on April 28. Carney, being a part of the Liberal Party of Canada, needs to beat his 2 challengers, Conservative Party of Canada leader Pierre Poilievre and New Democratic Party leader Jagmeet Singh. And let me tell you something, it's beginning to look like Poilievre and Carney are just 2 sides of the same coin, both supporting a healthcare system that doesn't work for most middle-income and low-income Canadians. Here's why. Mark Carney's healthcare vision. Here's how Canada's healthcare system is set up. First, it's publicly funded through citizens' taxes. Of course, second, the federal government sends money to the provinces through health transfers, but it's the provinces that run the system. That begs the question, what will be Prime Minister Mark Carney's proposed plan for improving Canadian healthcare? Well, plain and simple, Carney has promised to limit and cut government spending, but he made it clear that cuts to federal healthcare transfers would not be part of that program. And you know what? Conservative leader Pierre Poilievre shares Carney's view. While Carney has the same sentiments as Poilievre, both pledging to reduce doctor-patient waiting times, address the drug crisis, and collaborate with provinces for a more efficient and responsive healthcare system. What these two seem to overlook is that the real problem lies in the actual system, and how Ottawa's financial control can limit the healthcare in those provinces. More on that later. Let's see what Jagmeet Singh has to offer. Jagmeet Singh's healthcare vision. Now onto Jagmeet Singh, the leader of the NDP. This guy's been on a mission to fix Canada's healthcare system. Back in 2021, Singh promised to reverse those nasty healthcare cuts and bring in a national pharmacare program. Singh even blasted both Carney and Poilievre in an interview. Mark Carney has promised tax cuts for millionaires and reduced spending on services. That means cuts to healthcare. We know what happens when healthcare is left to crumble. It gives Poilievre the excuse he's looking for to call it broken and sell it off piece by piece. Let's be clear, Canadians are saying no to Poilievre's plan to Americanize our healthcare. But wait, there's more. Singh pledges federal action to give every Canadian access to a family doctor by 2030. He also vowed to end for-profit long-term healthcare. So now the million-dollar question is, who's got the better plan? Mark Carney and the future of Canadian healthcare. Here's the hard truth. If Carney or Poilievre end up in charge, everyday Canadians, especially those already struggling, will pay the price. For a better picture, for over 20 years, Canada has poured billions of dollars into healthcare than almost any other wealthy country with universal care. Imagine being on the same ranks as Switzerland or Australia in terms of budget for healthcare. Yet most Canadians are stuck with some of the longest wait times, few doctors, and lack of medical equipment. It's like you're paying for a 5-star meal and getting a cold sandwich. The main issue in Canada's healthcare system is mainly Ottawa's control of budget cuts, and reducing that role by reforming cash transfers to the provinces is both part of the solution for healthcare and one way to help cut federal overspending. Regardless of who wins the election, be it Poilievre, Singh, or Carney, the elected Prime Minister must prioritize comprehensive healthcare reform aimed at reducing costs and placing Canadians' well-being above corporate benefits. The system must serve the public, not function as a profit-driven enterprise for private interests. Ultimately, Canadians hold the power to shape their nation's future. Healthcare is a fundamental right, not a privilege. This is your moment. Vote wisely, and together let's demand a system that prioritizes people over profits. What do you think? Who do you think will win the election? Do you think Mark Carney or Jagmeet Singh is the man to lead Canada and solve Canada's healthcare problems? Subscribe to get updated on our latest videos. We've got more insider stories to share. We're just getting started.